I'm doing well. So, I'm here today to tell you guys a little bit about the Health Professions Post-Baccalaureate program at UC Davis. My name is Doug McLemore. I am one of the advisors for the program, and I'm the test prep specialist for the program. So as we go in this webinar, I just want to make sure I got the recording started. Yep. As we go in this webinar, if you have any questions, feel free just to pop your questions into the chat box or raise your hand and let me know what your question is, and I will try to tackle them as we go. So let's get a feel for who all's here. Where are you all from, and what medical or what health profession are you interested in? I don't believe I can enable that, so we'll have to use the text only. Yeah, it doesn't look like I can enable mics for you all. So we got California, PA. About the rest of y'all. Oh, we got somebody who's it looks like a program with pre-meds, dentistry, PA, MD, some PA, more PAs, MD, vet med, two vets, health-related research. I will say this for health-related research, post-bac programs may not be necessary for like a PhD program, but that's something I can talk about a little bit more later on. PA, MD, DO, very cool to see somebody calling out DO specifically. All right, so let's talk about our program. Curious to apply as a PA, but decided to do DO. Those are pretty different processes. Like the prereqs are different for DO school and PA school, and substantially so for the patient care experience. Like it's way overkill to do the 1,000 to 2,000 hours of patient care experience that you'd need as a PA or DO school. But DO school has you take things like physics that you wouldn't take for PA school. So they're a bit different of tracks. I would say you'd want to probably decide which way you want to go before you would end up doing your post-bac. But again, I'll give you a link later on if you wanted to ask about more specific questions like that. So in general, here's what our program is about. It is a academic enhancing program only. We are not a change of career program. I'll just put that out front. We serve all the health professions at the current time, which would be med school, vet school, dental school, optometry school, PA school, OT school, PT school. But PhD school is one of those that's not really our forte because, well, honestly, getting into PA school is a different process. So if you're going or PhD school, if you're going for a PhD, I'll have, like I said, again, I'll give you guys a link later on to get some, like talk to one of us one-on-one. We can talk about if this would be appropriate for you or not. Just because that's a very individualized question if you're looking at enhancing a GPA or getting into a PhD program. Our program is a 12-month long program. It starts in January and goes until December. And then you could do single quarters at a time. However, the single quarter program, it costs the same amount as the 12-month program if you end up doing 4 quarters, except you would not be able to take classes in the summer in the single quarter option. And you lose out on some of the other things like our test prep that's built in, the track system, the committee letter, and the wraparound advising that is included in the full 12-month program. So those things you see here at the bottom of the slide, those are all components of the full program that do not get, that the single quarter people do not get the benefit of. While you're in the program, while you're in that quarter, you can get advising. They wouldn't be able to do the other things in addition to that advising. Are you able to take a few prerequisites required for the program after applying, but you'll satisfy them before the program? Yes, that is correct. So we only expect you to have your prerequisite done before you start our program. you can apply before that is the case. So let's start looking at some more specifics. Here's the structure of our program. So you see, we started the winter quarter, that's January. And you'll be in 3 science courses, 3 upper division science courses that you can count towards your science GPA, which is generally what we're going to focus on here is your science GPA. The reason for that is because, well, your science GPA is going to move a lot faster. And if you build science GPA, you're also building overall GPA. So that's our focus, is on getting you in upper division rigorous science courses every quarter. In addition, we're going to have a support seminar for everybody. That's a learning and test taking strategies seminar. So we talk about what are some best practices couched in learning science of how to approach school, how to approach taking tests and things like that. The next quarter will up you to 3 to 4 science classes, depending how things went in that first quarter. We understand that a lot of people are coming from semesters, and that first quarter is a bit overwhelming because quarters go a lot faster than some semesters. So the next quarter we'll see, are you ready to go into 4 science classes or not? If so, you'll go with 4. If you need a little bit more of that gearing up time, we go to 3 classes. And then the support seminar for that quarter is going to be medical terminology. Now, I will say for the PA folks, you do need medical terminology as a prereq for PA school. This one will not fulfill that requirement. This one is a survey of medical terminology, so it will not get you everything you need for a full medical terminology course. Can you take upper division science classes during the single quarter? All the class offerings are pretty much the same for the single quarter as for the full program. If you already took the medical terminology, you would not have to do that support seminar. No. And GRE prep, if you already, I would say that's a conversation. Let's see if there's anything we could do with that GRE score. If it was, a score that you're happy with and that we feel like would make you a good, solid candidate, then I say we could not do the GRE prep as well. So there are some adjustments that we can make for that. Yes. During the summer, we changed tactics a little bit. We're only going to be putting you into 1 to 2 science classes at that point because, well, science, we have this extra little thing we call the track program, which I'll talk about more in just a moment. But basically, we give you an experiential experience. That's a really weird way to say that. But what we're end up doing is either put you into the clinical track, the health equity track, or the research track for the summer, as well as a course called narrative medicine, which we feel that everybody will benefit from because we all need to learn how to write a little bit differently. Science people tend to write more clinically, and we want to learn how to, or help you learn how to get some of this more storytelling into your writing. Because, well, hey, you're going to have to do a lot of it when you're writing your application, like personal statement, disadvantage statement, or what is now actually going to be known as the other important experience statement, or some things to that effect. All your secondaries and supplementals and blah, blah, blah. Tons of stuff to write. And finally, in the fall quarter, we're going to finish it up. 3 to 4 science classes. Again, we'll assess based on where you're at. And then we have an app prep quarter where we're going to be going through each component of the application and get you started on preparing things that are necessary for your application. Like we got some writing prompts we have you do. We have you start putting together your experience list and seeing what you've got to do yet and what you don't have to do yet and all that fun and stuff. So that app prep program, or app prep class, is 10 weeks of just let's get everything lined up. So when you finish the program, what we're trying to do basically in those next 6 months is get your application ready, finish your standardized test, get that application in by June, and voila, you're in the cycle. You're in the cycle immediately following. In the for prep wise, we do MCAT prep all 4 quarters because it's a big monster test. DAT prep will start in the spring, or OAT prep if there's any optometry. I don't think I saw any out there. DAT prep or OAT prep for the spring to the end of the year. And then for the summer, we start with GRE prep and go to the end of the year if it's necessary. Some of you may not need to take the GRE. For example, if you're pre-vet, You probably have heard that Davis dropped the vet requirement. So did pretty much every other vet school out there. And so it would be a conversation of if you even need the GRE at that point. It looks like we've got a couple questions. In order to qualify the program, I need all my prereqs. Let's put a pin in that one. Is there any leniency with the no less than 1 C- in prereq courses? Let's put a pin in that one until we get to the prereq requirements right about. Well, where is that slide? There we go. I'll come back to this, the other stuff. No, that is correct. PA schools, a lot of them have dropped the GRE requirement. However, they are not GRE. The ones that are GRE optional, it's still a good idea to take the GRE. So let's see. So we do have a requirement. There's no more than 1 C- or below in a prerequisite course. There's an important reason for that, and that's because when you're done with our program, we want you to be able to apply right into that next cycle. So we may be lenient if there's like only 2 C- in prereq courses, but I want to say that is not something that I would count on. The whole requirement for having 1 C- or less is because you could probably do that in the quarter following the program and then still apply successfully. But it starts to be more and more of them, then we wouldn't be able to get you in that upcoming cycle, which is actually the goal. So, and then the other question was prereq wise. You need to qualify for the program. Yes, your prereqs would want to be done before you end up starting our program. And the prereqs are different depending if you're going MD or you're going PA or you're going dental or vet, whatever. We're talking the prereqs for that type of a program. And we look at each one of those individually. Age of prereqs, you generally don't want to be more than 5 to 6 years, because when you're starting to get 7, 8, 9, schools may actually stop looking at them. But again, that is something that can be a little bit flexible. So if you have more specific questions on specific prereqs, like I said, I'll have a link at the end that you can set up an appointment with me just for a one-on-one, and then we can talk about your individual circumstances. With prereqs, if you've been actively in school the whole time and you haven't had any major breaks, then you would probably want those would probably be okay. But again, it can be different depending on different schools. If we have a few C- for our prereqs during freshman year, but have a really strong upward trend, would that be considered? Again, I would say no, because it's not the upward trend that's the issue. It's the fact that if you have C- for your prereqs, you have to take them again. You're forced to, because the schools will not, pretty much everywhere, depends on like most of the different health professions, require you to have a C or better. So if the prereq won't work for your med school or for your vet school or for whatever it is, then we want you to have it so it will work for that. For the bachelor's degree in a non-science related field with little no prereqs, that would be what would you call a career change program. And that would not be something you want to do with us because we don't have the ability to give you that career change program. So there are career change programs in California. We are a GPA enhancing program only. So here is a list of post-bacs and special master's programs in the state of California. And you can see that some of them will be labeled as enhanced academic record. Some are labeled as change career. Some are labeled as both. You would be looking for the change career programs if you still need to do a lot of your prereqs. You have the prereqs for DO, but apply for PA. Would it be okay to switch if you decide to? I would say no on the DO to PA requirements thing, because PA school requires additional classes that DO school does not require. So you've got to make sure that you've got the classes for what you want. DO PA split is not easy to do. Like a lot of people are thinking, I don't know which one I want to do yet. That's something I would figure out before doing a post-bac program. We'll satisfying a prereq before the start of the program decrease your chances of being accepted into the program? No, it would increase your chances, because if you have the prereq completed, then you would actually be able to get into the program. So yeah, completing your prereqs before the start of the program would increase your chances. And I'm not sure to what you are referring when you say, would you kindly share the list? Or if you were talking about the um, special masters and post-bac programs, then the list is in the chat box right there. Just a few messages up from where you're at. So that was a lot of questions about prereqs. I'm going to go back to get the other questions as we come up against those content areas in the rest of this, but I'm going to pick up from there and talk about the classes that we can get you into. So this is a sampling. This is not an exhaustive list, but a sampling of the classes that we were going to get you into. And how we do this is every quarter we end up negotiating with different faculty the ability to get you into those classes. So some of these classes are going to be with students at Davis, the undergrads. Some of these classes are going to just be by yourself. So we can get you into about 7 or 8. We usually give you 7 to 8 classes to choose from to pull your 3 classes out of every quarter. So we'll give you a list. We'll discuss the list with you, what seems to work for you. If we've got, say, a vet student, we'll try to make sure we have 2 or 3 vet options, sort of vet unique options throughout the whole program to make sure you can really customize what you're doing. But for the most part, it doesn't really matter what the science classes are when doing GPA enhancement. We just need to get you in those classes. The list of the post-bac programs is, I just put it in the chat box again. And no, I didn't, because I'm putting it into the hosts and panelists and stuff to everybody. Now, can you see it? That should happen now. So every quarter you end up getting a different set of options. And I can't say which options are going to be which in any given quarter, just because it's a conversation. We have to see what's available and see which classes we can fit you into. But by no means is this like the only classes we have, but these are the ones we tend to rely upon. And they're all upper division science. So they will all contribute to your science GPA. Notice we have no math classes here, and that's because most programs do not accept math classes as science. The only ones that really do are MD programs. So even for an MD candidate, the DO schools, if you want to be in that boat, DO schools don't accept math as science. So that's not part of your science GPA. So we don't offer math courses. We just offer basically all upper div science classes in this thing. And you don't have to register. We register for you. We take care of all of that. As far as the test prep is concerned, I've come to this program via having been in test prep for the bulk of my career. I've been teaching test prep for about 20 years now. I used to be the MCAT content director for one of those brick and mortar, assistant MCAT content director for one of those brick and mortar companies. So I've been in and around the MCAT for a really long time, as well as the GRE, the DAT, and the OAT, and all those other tests. And if there's any nurses out there, the T's or the HESI. So there's tons of these different tests out there. And that's where I come in, is that I've got a different way of doing this. That's not like, let's jam this stuff in our brains for 3 months and hope for the best. That's why we spread it out over the span of months. From the case of GRE, 6 months, DAT, OAT, 9 months, well, 9+ months, 6+ months, the MCAT, 12+ months. Because I want you to retain this information, darn it. Because remember, what are y'all going to have to do when your health profession program is complete? Are you done with the tests? Yeah, you got to retain the information, because you got to take another test. That is right. You got to remember this stuff. And because like you med students, you're going to have to take the step 1, the USMLE test. Maybe the COMLEX if you go DO. You got the PANCRE or the PANSI for PA schools. You got the blah, blah, every one of these programs, you got to get good at taking standardized tests, because you're never going to finish. So I'll help you break it down into really 4 pillars, as I like to think of them. And that's content review, practice, strategy, stamina building. These are the three things that you can do actively to build up your test or your test overall testability, I suppose. And I will help work with each and every one of you on your own personalized study plan. And then by doing so, by doing this repeatedly and doing this for a long time, we're going to be getting to a place where, hey, I feel confident. If I've got all these different pillars, I feel confident coming out with these standardized tests. So um, we still have some people struggle a little bit, but we have to understand what good solid scores are as well, because you don't need a 520 on your MCAT. I'm going to tell you right now, if you're trying to shoot for a 520 on your MCAT, that's overkill. So we'll help you understand the whole, like, what are good scores and what are not good scores. And for you DAT folks, get an 18. You don't need a 25. Get an 18. You're getting in with an 18. So we'll help you really understand standardized testing and what it really means to you so you can take that moving forward. And so what we do is we partner with Kaplan. Well, we don't partner. I buy the content from Kaplan. So I actually purchase the materials from Kaplan for everybody. You don't have to provide your own test prep materials. I will get them for you. And that way you have practice tests and practice problems and books with information and videos and all the wonderful things that go with it. And we will help you get ready for these tests. So use me for this. This is what I'm here for. This is why I've been doing this for a long time and helping students do this for years and years and years. As far as advising goes, we have what we call a high touch model. We're going to be having seminars every week because we want to interact with you every week. I would love to see people every single week, every other week at the latest. So we have the availability for you to self-schedule appointments whenever you need them. We're going to go through your GPA, fine tooth comb, and go through all your GPA courses, or GPA spreadsheet that I provide for you. That'll be just like, okay, where's my GPA now? How far do I have to get? Which kind of classes have I already taken? So I need to take these instead of these. So really trying to help you out there. And there's three of us that are doing that for you. That's Brielle McRae. She's the one you can see here in the blue shirt in the picture. And then another one is Jenny Moylan. She has been with us for a year and a half now, maybe longer than that, I think. And then myself, who is, like I said, been with the program since the beginning. So Brielle and I have been since the beginning, and then Jenny added a little bit later because we got to make sure we got enough people to help you all. The biggest thing we're working on right now, for example, is application prep. Each of us have a set of students that we're working with through that whole application process. And like, I'm making my students meet with me once a week and just like, let's go through the writing. Like, right now we're writing personal statements, we're writing your experiences and editing and making sure it says all the good things we need to say about you. So we spend that whole application process helping you build the primary application and get it submitted. After that, what we end up doing is we'll help you with the secondaries and the supplemental process. And then after that, we're going to help you with your interview practice. So you're going to have to deal with us for a whole nother year and a half after the program ends. Sorry, not sorry. So we're going to be keeping up with that whole process until you get into your program. That is our goal. That's what we mean by high touch model. As far as the committee letter, what we do is we provide a committee letter, which is essentially we have all of your letter writers submit your letters of rec to us, and then we will take those letters, combine them into one, and summarize all the high points, all the really good points into one letter, and then we add in our own take on you as a student. So one of the nice things about committee letters, well, that doesn't work for everything. PA schools don't accept committee letters, but dental schools and med schools do. But if you can't get a committee letter, we'll help you with a regular letter of rec ourselves. But the nice thing about committee letters for the schools that take them is all your letters are in one now. So you could submit additional letters on top of that. So it is a way to get some additional letters of rec into your application. Plus, the committee letter for the schools that take them are actually kind of highly looked upon because somebody has taken the time to collate this information and really pull out the key points. Then our tracks. So let's talk about the tracks. So we do health equity, clinical, and research tracks during the summer, like I said. And these are experiential, um, it's an experiential pace of our program. Now, it's not going to get you tons and tons of experience hours. You do need to have worked on your experience building all through this time, especially you PA folks who've got to have patient care experience coming out your ears. But health equity, what we end up doing is we partner with health equity public health organizations throughout the Davis area, the Sacramento area. I think we even had somebody because they lived closer to the Bay last year doing something with a group down um, in Vallejo. So what that would look like is that you're going to be learning about public health and health equity policies, and then be out in the community where you would be putting those policies into practice. So think like something like a student-run clinic or some such like that. So health equity, you get placed in one of these locations nearby, and that it helps you just learn about what's going on in the world of medicine, in essence. Yes, we do provide help for the personal statement. Wait, I'm maybe not. Let me come back to that answer. I think I'm maybe not understanding your question. Let me finish what I'm saying here. The clinical track is an EMT program. We're going to be doing the UC Davis Fire Department's EMT program. You're going to be in that program. It's a very well-renowned program, and it's busy, but in the span of 11 weeks, you are going to be able to take the EMT licensure program or exam, take that, and be a licensed EMT. And for those people who don't have a lot of clinical experience, this is a good one to do, because this allows you, especially for you PAs, by the way, it allows you to get a job after you finish our program as an EMT and start getting out there in the community and getting that tons of patient care experience that you really want. Research is we work out some arrangements with some research faculty on campus here in Davis. I believe we even had a researcher at UC Davis Med last year. And we partner the student with the researcher with a couple agreements. We want you to get about 10 hours a week of research experience. So this is for the folks that have never gotten any lab experience and they want to try to dabble in that a little bit, find out what it's like. And we work it out we talk to the faculty and we say, hey, we're not here to make you guys the lab dishwasher. We want them to actually be doing some real science in these research projects. So that's why we really focus down with those faculty and make sure that they're not having you just do nothing really. Generally speaking, we want you to choose the track that you have the least experience in. So if you already have an EMT and research experience, I would probably direct you towards health equity. That's why we have the 3 different tracks, because we know people have different aspects of these already taken care of. So the requirements, and I know we've already dealt with a lot of these requirements already. I first also want to put this out. We will break some of these rules based on the whole holistic idea. So yes, these are what our minimums are, but I'm going to look at the application as a whole and see if you're a good or bad fit kind of thing for us. And that depends on more than just the stats. But we do want to make sure you kind of got an idea of where we're coming from. Minimum of 2.8 cumulative GPA, not science GPA, cumulative GPA. And the reason why 2.8 is because in a program like this that's 1 year long, you can really generally only raise the GPA by about 0.2. So that would get you into the 3.0 range, which is a good GPA to be in after having done a post-bac. No more than 1 C- or below in a prerequisite. Talked about before, but I'll mention again. The reason why we want you to have your prereqs in a C or better scenario is because schools that require these classes require C or better. And our goal is to get you ready to apply in the cycle following our program. You need to have your BS degree by the time you start the program. It does not have to be finished before you apply. Like if, say, you're graduating this spring, but you want to apply this April, that's perfectly fine. So as long as your bachelor's degree is in your pocket before you start our program. We're going to need official transcripts from all the schools you went to, and we use Post-Bac Cast. That's where you're going to submit them to. And that includes Community colleges, that includes if you attended more than one four-year institution, even for just one or two classes. That includes high school classes that you took through a community college. If you did an early college high school or something like that, we want to see those as well. We ask for 2 letters of recommendation, one science faculty, and then another person. Now, the science faculty is where we fudge from time to time because we are aware if some of you have been out of school for a while, it might be difficult to come across a science faculty to write a letter of rec for you. So we will fudge that based on, what we see with how long you've been out of school. We do ask for a personal statement that says why you want to be what you want to be. Why are you getting into medicine? Why are you getting into dentistry? Why are you getting into veterinary science? We also want to, we ask you for a second essay, which is why are you in need of a post-bac, and do you know what you're going to get out of it once you're here? Basically, think I got into a little bit of trouble with my GPA. Here's why. I've taken care of some things, and here's what I really want to get out of this post-bac. We want to know that you're ready to throw yourself into this thing and just boom, get her done. You're not going to see UC Davis in the Post-Bac Cast website until the application opens, which is on April 1st. And then we also will do interviews. We will ask, once we review your application, once it's submitted, we will call interviews, and then we'll tell you within a few weeks whether you've been accepted into the program or not, because we do rolling admissions. So if you're familiar with rolling admissions, that means you should apply early because we're trying to fill from the get-go. We're going to start looking at the applications in batches, basically. So it's the fastest to take the course to get into the 3.0 cumulative range with the idea to create a year's worth of upward trend. There's a lot of units and the GPA doesn't move much. So the goal is to do both, actually, to get your GPA up into the 3.0 range if at all possible, and while doing so, creating a year's worth of upward trend. So, and again, that now you're talking possibly an individual type question where, like, how many is a lot of units? So we'd have to look at what you had already, and we got to look at holistically what that actually means. So we understand that, like, when you get to like 250 units, you're not going to move very fast. But that's why I've done the math and said most people can reliably move their GPA by about 0.2 if they do well in our program. That's about it. 0.2 is about the max we can get out of that. So what's the difference between applying this program at UC Davis and the California Post? So the California Post-Bac, or the California Post-Baccalaureate Consortium program at UC Davis, that's the medical school. They're an August start. They are different than us. They start in August. We are not the same program. They hold their program on the UC Davis Med School campus, and we are over here on the UC Davis home campus. And they have a disadvantage requirement. You have to have some kind of disadvantage passed to get into the program, the Post-Bac Consortium program. There's some other differences, but they also have test prep and So make sure you're looking at the correct program. They start in August. We start in January. That's why their deadline is this coming March 27th, because those programs you have to apply by March, usually at the latest April, to get into those fall starts. You can apply to both. We don't work together. That's a completely separate program from us. So I will not see your application to them, and they will not see your application to us. Is the science GPA the same, or could that go higher because the science courses? Yeah, the science GPA is going to move a lot more than the cumulative GPA, because the science GPA is like, you usually have less science courses. So since you have less units in science courses, your science GPA is going to go faster than the overall GPA, the cumulative GPA. Now, the question you've all been probably wondering is this one: how much does it cost? So our 12-month program is $30,000, and that does not including housing, insurance, and transportation to study. You're basically your living expenses. So your $30,000 tuition goes towards classes, the surrounding services, registering for classes, our Timely Care, which is a mental health organization we work with, those types of things. If there's books required for classes, if you're commuting, rent, of course, and food. Those are things that are on you. So the thing about our program is, since it's a certificate program, it does not qualify for federal funding. So a FAFSA will not help you with the funding for this. You would have to use a private loan or personal, like out-of-pocket funding for the program. We do have preferred lenders, and we can send you to our financial person who can help you figure all the details out about doing that kind of a loan before you come to us. We do expect people to have their own health insurance, just because, well, number one, I don't want you to get sick partway through the program and lose out and not be able to get healthy again. So that's our price. And if you're doing the quarter at a time, each quarter is $7,500. The tuition is due up 2 weeks before the quarter begins. The tuition is due 2 weeks before the quarter begins. And we do have a deposit should you be accepted. The deposit, I believe, is $500. And right now we have a deal going on. If you get your application in before the first deadline, which is on April 30th, we'll give you $300 off your overall tuition. So the how to apply part is you look up us, UC Davis Health Professions Post-Bac program. That name, be careful, the consortium has Davis in it. You would look up the Post-Bac program, UC Davis Health Professions Post-Bac program in Post-Baccalaureate, and our application opens on April 1st. I believe you won't even see the application until April 1st. And then, so since it's rolling applications, getting your application in early is important. Something to keep in mind too, by the way, the Post-Baccalaureate, when you submit to Post-Baccalaureate, all your documents, the personal statements and all that, have to be included before you submit before the deadline. And note that the deadline for Post-Baccalaureate is in Eastern time, not Pacific time. So if it shows the deadline is midnight, that's midnight Eastern time, which is 9 p.m. our time. We've had some people miss a deadline because of that. There's not a lot we can do because Post-Baccalaureate is kind of crazy. What's the letter we need to write called again? Do you mean the personal statement? So yeah, we have two personal statements. Like I said, one was the traditional, why do I want to be a insert health profession here? And the other one is, here's why I need a post-bac program and here's what I intend to get out of it. Don't really have a good name for that one. All right, let's see. What other questions did I miss? What is the character limit for each? Oh my goodness. I don't remember. I think we set it at 5,300. The reason I think we set it at 5,300 is because of the fact that MD and DO both take 5,300 personal statements. And we usually get mostly MD folks. So I don't know 100%. If you are still curious, here, email postbac@ucdavis.edu and ask them that question. They'll be able to answer that. Can you repeat what you said about having the science reference if we're a bit unsure how to get one? Well, the science reference, we want to get a reference from a science faculty, but we understand that if you've been out of school a long time, that you may not be able to get one. So if that's the case, we will overlook the science letter and take 2 letters from any other source. Is there a percentage of students that apply and get in after post-bac from UCD? Do you mean get into UCD after our post-bac or get in to post-bac period? Get in from a post-bac period? I want to clarify the question. So from our program. At this point, I can only give you statistics from one cohort. That's because we're still in the process of our second cohort. We're a fairly new program. So our first cohort has already been in and done. We had 13 people that finished the first cohort that applied, and 12 of the 13 were accepted into whatever programs. That's vet schools, dental schools, PA schools, etc. Um, this current cycle, I don't know the numbers yet because we're still waiting. So I will hope to update that once we finish this cycle. I will have updated numbers once we get to. We'll probably update the numbers in April because that's probably when most people are going to know one way or the other. If we applied to grad school one cycle already but did not have access, do we still qualify? Yeah, you can apply to our program even if you've applied to in a previous cycle. A lot of our students are actually in that boat. What would be good examples of other sources to use as a reference? Well, probably somebody who can speak to you as a character reference and a professional reference. So a boss from a job, an advisor, not colleagues, maybe not so good, but anybody who's like in a supervisory position over you would be good sources for references. The recording link will be sent out to everybody that has registered. What is the class size of the Post-Bac? Our Post-Bac, we run around 50 students in the class size. We try not to go beyond that because we want to be able to give you good experience. We want to make sure that we have time to help all of y'all. So what type of academic support do students receive if they're struggling with courses in the program? Tutoring. We do not have a tutoring component to this. The academic support that I can give you is basically academic support on the test prep side, but like is beyond that for like if you're struggling with a class, I can try to help you out by saying like, work with the professor and give you some ideas there. But we don't have any tutoring as part of this program. What is the acceptance rate into the program? That's actually kind of a loaded question because I don't think the acceptance rate is a good thing to look at for post-bac programs. I can say I think we accepted about 50% of applications last year. We tend not to look at it that way because a lot of the people that don't get accepted never do like they might submit the application, but they didn't complete the application. So with an incomplete application, is that really them being denied entrance or is that just them not finishing the job? So I think to think about acceptance rates into post-bacs, what we look at if we think we can get you into a program. Like I can't say that we've turned anybody away because we did think we could get them to a program, but we wanted to take these people over those people. Our goal is to say to ourselves, based on our application and interview, are we convinced that we can help you apply successfully in the next cycle? If we don't feel that, we might actually say to you, come back next year because we think you need this and this and this. We actually have a conversation with you if you don't get into the program about like what it is that we felt was missing from your application and what you might need to do to be ready to get into that program later on. Are the one-year organic chemistry, physics prereqs required for individuals applying to programs, some like veterinary schools don't require? So that we look at, again, that's kind of a one-off type situation, but I would say for physics, vet schools, not all of them only require 2 quarters. There's plenty of veterinary schools that require a whole year. So in that kind of scenario, we're going to be looking at all the vet schools, not just a couple. Or for the same thing for MD. Like, yeah, there's some MD class schools out there that might require you to take physiology, but we're not going to say, like, we're going to look at the bulk of what those schools as a whole are looking for. But that sounds like a more individual question. So let me get that link for you actually right now of how you can contact us and set up a one-on-one appointment to ask those more specific questions. Where is that? Here we go. So if you use this link, you can actually schedule an appointment to meet one-on-one, and it's a 20-minute appointment, and we can talk about whatever your specific situation is and see if you're a good fit for the program. Can I talk a bit more about the disadvantage? We do not have a disadvantage requirement. I repeat, that is not us. The disadvantage requirement is for the UC Davis Medical School Consortium post-bac program. And I would refer to them to understand what they would expect to see in a disadvantage requirement. So we are not the ones that have the disadvantage requirement. Did I miss any other question? The medical terminology course must be taken on our own time if it's not already satisfied. If you're a pre-PA, yes. PA, you do need to have a full 1/4/semester medical terminology course under your belt. So you'd have to be able to do that on your own. That could be done like after the program. That wouldn't be something we're definitely going to look at. Program have anything in terms of helping people achieve? So does any program have anything in terms with helping people achieve clinical hours? Not a substantial number of clinical hours, no. But if you end up needing a substantial number of clinical hours, I would look at the EMT program or the EMT track, because that'll get you the license, that'll get you a job that can get you those hours. I'm just looking through the questions to see if I missed any. I think I've got all your questions covered up to this point. Any other questions y'all have about the program? See if I forgot to mention anything. Oh, I did forget to mention one thing. We do have a series of classes that we call refresher courses. There's a GChem, there's an OChem, there's a physics, and there's a biochem, and then there's a physiology class. These are 1/4 long classes. They will not cover a prereq. Let me repeat, they do not cover a prereq. But if you're, say, taking the MCAT and you really struggled with physics on the MCAT, it's a survey of the physics, all of physics, with an eye towards standardized testing. So they're what we call our refresher courses. And so there's a GChem, an OChem, a physics, a biochem, and a physiology. So if you're feeling a little uncomfortable with certain topics, it's okay to take one of those again. And they still also count towards your science GPA. Will there be help finding private loans, or do we have to find them? So I can set you up with the individual you need to talk to that can tell you who our private lenders or who our preferred lenders are. But at the end of the day, you have to apply for and obtain the private loans. We can help you out. We can tell you what you need to do that. But at the end of the day, you've got to get those on your own. But we do have a person on staff, so set up an appointment and we can talk about that and help you get a hold of that, get in touch with the person who works with students on the financial side of things. How could a working student navigate this program? We encourage you not to be working during this program. The goal of our program is to be or you're basically looking at like 40 to 60 hours of work a week in this program. So it is very difficult. And we've seen students do really well for like 3 quarters and then get a job in their last quarter and just tank their last quarter, which is absolutely what you don't want to do in a program like this. So if you're forced to have to work throughout the length of the program, I would encourage you not to do a full length or like a condensed 1-year program. I would actually look at some of the programs like the extension programs, Berkeley Extension, because they can do that where we cannot. So we understand that people do have to work, but our program isn't set up with that in mind. Where can I find the medical terminology requirement for PA school? Do you mean what what school, or sorry, what where you can take that medical terminology requirement, or what the medical terminology requirement is. And in the meantime, are there any time slots available for April? Time slots as in, oh, for the information sessions or for the one-off appointments? Is that what you're talking about, Disha? I'm going to be updating my availability for those by the end of the week, because I had to figure out what my spring quarter availability, or what my spring quarter schedule is going to be. So I'll be adding more appointments in April, May, and June by the end of this week. For example, I'm looking at UC Davis PA schools. So not all PA schools require medical terminology, but there are enough of them. It is something I would consider taking. So different schools have different expectations. Like, for example, if you want to go to PA school in SoCal, you're probably going to have a year of Spanish. Because there's like San Diego, UCSD, or is it UCSD? I think it's UCSD's PA program. And there's another one in LA. They require Spanish to be in there. So every program's a little bit different, but not enough of them require Spanish that I would say you have to have that. Do you know if the UCD Post-Bac Consortium has online pre-recorded meetings? I don't know. I don't know if they do pre-recorded meetings. I would just contact them, use their contact information, and find out what they're looking at. At this point, since their application's due in a couple weeks, I don't know if they're going to hold any more programs, but I would imagine they would have something they can send you. So just email them, give them a phone call, and they can probably tell you about that. All right. Any other questions? These are all great questions, folks. We cannot get you access to on-campus housing, unfortunately. So it would have to be in the community at large. We do help people roll their leases over, because it's a really weird time to start a lease in January in Davis. So what we do is we connect all the previous cohort folks with the upcoming cohort folks. And we've basically had students in the same off-campus apartments for like a couple years now, because they keep turning the lease over to the next group, and then to the next group, and to the next group. So we're getting a lot of subletting going from cohort to cohorts. But surprisingly enough, we do have some people that commute from really far away. We have a person commuting from Santa Cruz this year. That's far. All right, it seems like we're running out of questions. Oh wait, no, here more questions popped up. How likely is the student would be? How likely is it that a student would be enrolled in this program? I mean, like I said, we accepted about 50% of the applications last year. I can't I can't say like there's this likely chance. It's again, are you ready for the program to be able to get out of the program and apply in the coming cycle? That's what we're looking for. We strictly deny students if they have more than one C. No, C's are perfectly fine. I think you mean C minuses. We strictly deny students if they have more than one C minus in a prerequisite, and not strictly, but like if it's like 6 or 7, definitely we need you to have those fixed up. If it's like 1, maybe 2, we might be able to talk. But again, that's what that's what this link is. So hop on and set up an appointment with me, and I can try to talk to you about that individually and see what you're looking at. How many days a week are classes? It's your traditional Monday, Wednesday, Friday / Tuesday, Thursday combo classes that are going to be available. It depends on what you're signed up for. Oh, that question Christina asked there was a follow-up to that. How likely is a student be enrolled in this program if they're close to the bottom of the requirements? I mean, I think it's as likely as anybody. Like it's again, we're not looking at the numbers as being the measurements. We're looking at, are you ready? Do you know what you're getting yourself into? And would you be ready to apply after you finish our program? That's what we're really trying to find out from your application and your interview. Yes, the debt is a serious thing that you should be worried about because money sucks right now. So yeah, I'm happy to talk with you all about anything like that. Our class size is approximately 50 students. I can't say it's going to be exactly 50 students. Would it be helpful to prepare anything for you prior to the meeting? I think is have the questions in mind you're trying to clear up so we can get right to tackling what it is that we're trying to figure out. And I applied to dental school this year next to applying post-bac. Do you mean apply post-bac and dental school at the same time? And if you get into dental school, you don't do the post-bac? Yes. So yeah, you can do both. There's nothing to say you can't. I would say applying to dental school this year, you're not necessarily going to find out about your whether or not you get into the dental school maybe until as late as April. Although since dental schools do rolling admissions, hopefully it's sooner than that. So you can. I don't know if you would want to. Again, that's a more of an individual decision I think you would have to make of like, do I want to potentially start a post-bac and then finish like stop partway through because I got into a dental program? That's what would probably happen there. 50 students per cohort. We do the cohort basis. Every year we do one cohort. So you would all be applying to our 5th cohort that starts in 2025. Convenient how that started. How many days a week are classes? It could be 2, it could be 5. It's just like registering for college classes. It depends on the schedules of those classes. So I can't say it's going to be this many days. I mean, I would expect at least 3 days a week. When do we get decisions for acceptance rejection? Once we do the interview, well, if we reject at the application, you'll get them probably less than a month after you apply. If you get an interview, we usually try to turn those around by, 2 to 4 weeks after the interview. Since we're rolling, we want to get everybody in, get it figured out, all the financial stuff, the registration and all that fun stuff. So we try to keep the process pretty snappy. We got one more minute, so one more question if you got it. Classes start whenever the quarter starts in Davis in January. I want to say, I just looked at my email. A bunch of people already signed up for appointments. Good to see. I'm trying to figure out. It's usually the first week of January or second full week of January. Looking to see. Yeah, I think it would be Monday the 6th, January 6th this year. So January 6th, 2025, I believe. And will this recording be sent out? Yes. Everybody who registered for the seminar or the webinar will get a link to the recording. Is there an estimate month of when we'd know? It's rolling admissions, so I can't estimate the month when you would know. So rolling admissions means we take the applications as they come in, and we will try to make those decisions as quickly as possible. So the sooner you apply, the sooner you will know. Where do I recommend to retake C minuses? So technically you cannot retake C minuses in California, but you can take other classes that you can use as prereqs. And I would say do that at community college. Community college is the best way to get those classes. Yeah, it is totally appropriate to schedule one-on-ones if we want to talk about the housing financial advice and figure out how that might work for you. So here, once again, is the one-on-one link. And here, once again, is the, well, I can't find it. But yeah, I think there's the one-on-one link. Oh, I know what I was going to do. And here's the email address where if you have any additional questions, you can follow up there as well, postbac@ucdavis.edu. So thank you for, no, not 5,300 words, 5,300 characters. Characters. That includes spaces. Yeah, 5,300 words would be massive. Nobody would ever want to read that size of a personal statement. That's a huge, yeah, 5,300 characters, I believe, is the length for our statements. But yeah, that turns out to be like a solid 4 paragraphs. Depends on how long your paragraph writing is. All right. Well, let's call it a day. And like I said, if you have anything else, just pop in the one-on-ones or send us an email and we'll go from there. No worries. I might have actually said words unintentionally, so that is very possible. I think I take it for granted that it's everybody knows it's characters and not words for these things. No problem. Thank you all for coming down. Stop the